Hi, my name is Erin Allen, and I'm a certified athletic trainer. Today I'm going to present on anterior cruciate ligament injury prevention in basketball athletes. Basketball is historically a non-contact sport played by both men and women. Basketball involves landing, jumping, cutting, acceleration, and deceleration tasks that are considered to be high-risk movements for causing injury, which indicates the need to reduce the injury risk by creating injury prevention programs. Lower extremity injuries make up about 66% of all sports injuries, with the most commonly being the knee. In an NBA consensus, knee pain was the number one injury for time loss in basketball players. A particular devastating and significant knee injury that occurs frequently in basketball is an anterior cruciate ligament rupture. The anterior cruciate ligament, or ACL, is located within the knee with the primary goal of preventing anterior translation of the tibia in relation to the femur and provides rotational stability of the knee. In fact, about 200,000 ACL injury occur annually in the United States, which results in surgery and about 6 to 12 months of rehabilitation before the athlete can return to the court. ACL injury rates are high, as about 2.8 to 3.1 injuries per 10,000 exposures occur in women's collegiate basketball and soccer players. And ACL injuries occur about 3.5 times greater in female basketball players than do males. Although there have been improvements in both surgical techniques and rehab protocols, there's still a 25% chance an athlete that returned to sport following ACL surgery and rehab will sustain another ACL tear. Most ACL injuries are frequently a non-contact injury or occur from indirect contact, which typically involves uncontrolled lower extremity biomechanics, indicating the need to screen athletes for poor movement patterns and dysfunction, as well as creating an injury prevention program to help prevent these injuries from occurring. So why should we implement an injury prevention program? Well, there are many benefits. Many of the injuries that occur during basketball games, practices, and training can be prevented by educating the players, parents, coaching, and training staff. Two of the primary benefits of implementing an injury prevention program is a decreased risk of ACL and other knee injuries and the improved athletic performance. Previous research strongly supports the use of a multi-component injury prevention training program to decrease the risk of a non-contact or indirect contact ACL injury and other knee injuries that occur during physical activity in both males and females. Following an injury prevention program, athletes will demonstrate improved movement techniques and muscle activation, improved lower extremity strength and power, and functional performance, making them better athletes on the court and in the weight room. The injury prevention program and screening tools that will be utilized are inexpensive to perform and require minimal time and are effective in reducing the risk of injury, which will allow our athletes to stay and play longer. So prior to developing an injury prevention program for basketball athletes, I would perform the Functional Movement Screen, or FMS, which is a predictive assessment for clinicians to determine movement patterns that place an individual at risk of injury. This assessment is used when working with patients or athletes where movement is an essential component of their activity, such as a basketball player. The goal of the FMS is to observe and assess quality of fundamental movement patterns to identify physical limitations, weakness, imbalances, or poor motor control. The assessment consists of 7 fundamental movements that require a balance of both mobility and stability for the athlete to perform each exercise correctly. The FMS provides great detail to assist in forming a comprehensive injury prevention program for each basketball athlete by ranking and grading each movement pattern to observe each athlete's ability. This functional assessment focuses on discovering movement patterns while also providing 3 clearing tests, which will assess the athlete for pain with shoulder rotation, trunk extension, or trunk flexion. The key to correcting and preventing ACL injuries is by maintaining and restoring proper movement patterns. The functional movement screen includes 7 fundamental movement patterns, which are listed here: the deep overhead squat, the hurdle step over, inline lunge, shoulder mobility test, the active straight leg raise, trunk stability push-up, and rotary stability test. These assessments are simple but require good flexibility and movement control to perform. The functional movement screen also requires little equipment to conduct the assessment and can utilize equipment most facilities already have, making this an inexpensive assessment to implement anywhere. Additionally, the assessments take little time to perform. And there has been contrasting evidence supporting this assessment, yet it's frequently used in research in many other injury prevention programs throughout my area regarding injury prevention. So a recent study published in December of 2018 concluded that the functional movement screen was able to identify collegiate female athletes who are at risk of sustaining a non-contact ACL or lower extremity injury. Furthermore, those who scored a 14 or less on the functional movement screen had a greater injury risk of sustaining a non-contact lower extremity injury, making this a very good assessment for this population. So as mentioned, there are 7 fundamental movement patterns utilized in the FMS. So here's just a brief overview of each component of the comprehensive evaluation. The first test is the overhead deep squat, which is looking for equal mobility and movement patterns through the hips, knees, ankles, core, shoulders, and thoracic spine, so a little bit of everything, taking note of pain and movement dysfunction. The athletes will raise their arms overhead, slightly wider than their shoulder width, and extend their arms fully, as seen in the picture. They will then squat as deeply as possible while maintaining proper form. I will assess for mobility from each body segment, taking note of any inabilities or pain. All of these assessments are scored based on the athlete's function and any symptoms of pain. The scoring system includes labeling each movement pattern and ranking each one. So I'll be assessing for each motion for the desired movement is unlimited and unrestricted. The second assessment is the hurdle step over maneuver, which is assessing the athlete's stride mechanics, stability, and control in single leg stance, which can expose movement dysfunction and compensatory patterns. The movement requires the athlete to perform proper control, stability, mobility, posture, balance within the hips, knees, and ankles. The athlete starts with their feet together in contact with the base of a hurdle or a 2x6 board with a hurdle height equal to their mid-shin, which is just below their kneecap. The athlete is to step up and over the hurdle while holding onto a dowel rod with both hands to prevent the arms from assisting. This movement will be scored looking for dysfunction within the movement pattern. The next assessment is the inline lunge test, which challenges the athlete to control the deceleration while maintaining balance. The goal is to assess how the athlete controls rotation and lateral movements as they move through the lunge, challenging the mobility and stability of the hips, knees, ankles, and feet, while also testing for flexibility of the back and hip flexors. The athlete will lunge a predetermined distance based off of their personal measurements, with their arms holding a dowel rod behind their head to limit help from their arms and remain in contact with their spine throughout the movement. The athlete will lunge out and slowly lower to gently touch the floor and then return to their starting position, kind of shown in the picture there. The fourth assessment is screening for shoulder mobility to ensure we have a comprehensive exam of the whole body. The shoulder mobility assesses bilateral shoulder range of motion and thoracic and scapular mobility, looking for asymmetrical movements or dysfunction. During this assessment, we will be testing shoulder internal rotation, extension, and adduction with one component, and then external rotation, flexion, and abduction with the other component, which collectively assess all shoulder movements. So the athletes will place both hands behind their back in a smooth motion with their hands placed in fists. One arm will go above their head while the other below, kind of shown in this picture here. And a measurement will be taken to determine the distance between the two hands for scoring purposes. And then a shoulder clearing test will be performed following that previous assessment to test for shoulder pain present with the movement pattern. The athlete is to place their hand on the opposite shoulder and attempt to point their elbow upward and touch their forehead. With this will influence the score of the shoulder mobility test if pain is present. And another assessment that we will do is the active straight leg raise test, which is designed to test the movement of the legs separately from the trunk, assessing hamstring flexibility, hip mobility, and core stability, which can have a great influence on ACL injuries and poor movement patterns. So the athlete will lay on their back with their arms at their side. The athlete will then raise their leg with their toes pointed towards their body in a straight knee, while keeping the other leg on the floor. The athlete is scored on how well they are able to meet all criteria and moving their leg past the dowel rod that is placed as a measurement tool that will be placed perpendicular to their hips. Now, another assessment is the trunk stability push-up, which is not an assessment for upper body strength as you would think, but it's rather to test the athlete's ability to stabilize their spine and hips as they perform the push-up. The athlete will start on the ground in a push-up ready position with the feet on the floor, and hands shoulder width apart. The athlete will perform a single push-up, lifting the body as a unit. If the athletes are unable to perform this at whatever level we are in, modifications can be made. So we're testing the athlete's ability to stabilize their hips and spine during this upper body movement pattern. And then after this assessment, another clearing test will be performed, which is graded as a pass or fail if pain is present with spinal extension. So the athlete will lay on their stomach and press up into a prone press up position, which is shown here in the picture, keeping their hips on the floor and extending their spine. And if pain is present, then that will influence the score of the trunk stability push-up test. The final fundamental movement pattern is the rotary stability test, which requires movement control of the trunk and extremities, as well as core and shoulder stability, coordination, and mobility. So it's a very comprehensive assessment. The athlete will start on all fours with the shoulder and hips both flexed to 90. The athlete will then lift off a hand off the ground while lifting the same knee off the ground and extend each arm and leg, and then bring the arm and leg back together so their elbows and knees touch, as shown here in the picture. The movement is scored on based on how well the athlete performs this test. And then the final clearing assessment will be performed after this assessment, which is assessing for pain with spinal flexion. The athlete will rock back on their heels, as shown in the picture, with their hands on the ground. If pain is present during this test, it will influence the score of the rotary stability test. So the FMS is frequently used in research, as I'd mentioned, and is able to identify collegiate female athletes who are at higher risk of sustaining a non-contact ACL or lower extremity injury. However, there is still some conflicting information about the assessment. So I'd also perform an additional assessment that evaluates the athlete's landing mechanics during a drop box vertical jump. This is the landing error scoring system, which has been shown to be a reliable test and can identify individuals who are also at risk for non-contact ACL injuries as well. The LESS is used to identify high-risk movement patterns, so another component that can influence the risk of ACL tears. And there's been a recent modification to the assessment, which is the one that I will use, which is the landing error scoring system real-time, which does not require any equipment other than the tools already present at most facilities, which would be a 30-centimeter box. And the real-time assessment assesses 10 jump landing characteristics, and the athletes begin in a 30-centimeter box, and they jump forward off the box, landing on both feet, then jumping again as high as they can off of both feet. The movement will be looking at how the knees, hips, and ankles move through these movements and their mechanics when the athletes take off and land, which is a contributor to non-contact ACL injuries. And this assessment is then scored by the clinician, who assesses the movement from both the front view and the side view to make sure we get a comprehensive test. So following the functional movement assessments, we will then implement injury prevention strategies and interventions that are specific to each athlete to reduce the risk of sustaining an ACL injury. To begin, some general injury prevention guidelines we will administer are checking for basketball appropriate, properly fitted footwear for each athlete. Athletes who have had previous ankle injuries or exhibit ankle instability following the initial assessment, we will recommend using protective ankle braces or taping to reduce injuries and provide some more stability. Furthermore, educating our athletes on the importance of hydration before activity and throughout the day is always an important consideration. So within some practice considerations to utilize that will further assist in reducing injury risk without changing the practice schedules would be just to select some activities that challenge the athlete's body awareness and reaction abilities. Also incorporating plyometric or explosive movements such as jumping into practice drills. And then don't be afraid to correct their basketball techniques and their movement patterns to ensure their basketball techniques are correct. Also enforcing the proper rules of basketball will further decrease the risk of injury. So an injury prevention program that we would utilize before practice and training would be the sports metric, which is the first and largest ACL injury prevention program that has proven to decrease the risk of ACL injuries in female athletes. The injury prevention program follows the recommended criteria of a multi-component injury prevention program, which consists of a dynamic warm-up, plyometrics, strength, and agility. This injury prevention program requires very little equipment and very little time to complete. This program takes about 20 minutes to complete all of the exercises and is perfect to implement into practice warm-ups and before strength and conditioning programs. The program's dynamic warm-up consists of straight leg marching, hand walks, cradle walks, and hip rotator walk, followed by plyometrics designed to emphasize quick turnover with a tuck jump, squat jump, 180-degree jump, scissor jump, and barrier side hop jump. The sportsmetric injury prevention program also consists of strength training that includes steamboats, lateral steps with bands, supine hamstring bridge, abdominal crunch, and prone plank. The strength training is followed by flexibility, which includes a hamstring stretch, a hip flexor stretch, quadricep, and calf stretch. And the final component is the agility element, which consists of quick feet and the Nebraska drill, simulating a figure 8 pattern. Further exercise intervention strategies beneficial to reducing the risk of ACL injuries is implementing a progressive preseason conditioning program that will prepare the athletes for the demands of basketball and beginning the program 2 to 4 weeks before the season begins to address flexibility, strength, balance, coordination, endurance, agility, and basketball-specific techniques. While strength training, some exercise recommendations that address the risk factors that influence lower extremity injuries include clamshells, bridging, quadruped exercises, prone and side planks, a Nordic hamstring exercise, single leg and double leg squats, walking lunges, single leg balance, lateral step downs, incorporating plyometric training such as squat jumps, tuck jumps, box jumps, skater hops, broad jumps, forward and lateral hops, both single and double leg, and agility training, which can be incorporated with backwards jogging, shuttle runs, bounding, cutting, and karaoke. As previous research discovered the importance of lower extremity flexibility facilitated by dynamic warm-up, hip and core stabilization, neuromuscular and muscle control, and closed chain strengthening are all key components to reducing poor movement patterns that place individuals at risk for ACL injuries. Ultimately, there's a substantial need for implementing an injury prevention program for basketball players, particularly females, to reduce the risk of anterior cruciate ligament injuries, reduce time loss in competition due to such a significant injury, and increase the functional performance for our athletes. Screening the athletes and implementing injury prevention strategies and solutions are easy, efficient, and effective. Therefore, it's a no-brainer to incorporate injury prevention programs. So let's get started. So here are the references that I've used throughout my presentation. Does anyone have any questions?